How can abortions affect your future fertility? Today, I want us to discuss abortions and how they can affect your ability to conceive in future. Hello guys, welcome to the fertility series with Dr. Raisha, and here we talk about fertility, women's health and everything in between. Today we are talking about abortions and how abortions can impact your future fertility. Now, we have two types of abortion. We have spontaneous abortion and induced abortion. Now, in spontaneous abortion, it is the undeliberate termination of pregnancy. We usually call it a miscarriage. You did not intend to lose this baby. Whereas induced abortion, it is the deliberate termination of a pregnancy. You did not intend to carry this baby to term, and hence you decided to terminate the pregnancy. So now when it comes to an abortion, we have procedures that are carried out to terminate the pregnancy. And these procedures depend on the gestational age of this woman. I mean, how far along are you? If the woman is in the first trimester, that means the first 3 months of a pregnancy, we can do what we call medical abortion. This is where we administer an abortion pill to terminate the pregnancy. But then we have another surgical procedure that could be carried out that is called the manual vacuum aspiration. Now, this procedure is gentle suction to remove the fetus from the uterus, but this has to be carried out in an hospital. Now, if the woman is in the second trimester and she is from month 4 to month 6, now the doctors do what we call a dilatation and curettage. And by this we mean that they dilate the cervix, they get to visualize the uterus, and then they remove the fetus and the placenta. Generally, abortions do not affect fertility, and a woman can ovulate even 2 weeks after an abortion. And after abortions, women are advised to choose a family planning method to prevent pregnancies till they feel that they are ready to conceive. But we could have some complications that can occur during and after the abortion procedures. Number one, when the doctors are doing a D&C procedure, that is the dilatation and curettage, there could be an injury to the uterus. Now, an injury to the uterus could lead to uterine avulsions, could lead to scarring, and this could impact future fertility because it will lead to implantation problems. When there is a scar, the fetus will not be able to implant. Another thing is that there could be infection. A woman could get a pelvic inflammatory disease, and this could lead to scarring and avulsions inside the uterus, impacting future fertility. Another thing, there could be an incomplete abortion. So maybe when they do a D&C procedure, there are some remains that could be left inside the uterus. And when these remains are inside the uterus, this woman will have trouble conceiving. Now, let's talk about Reisha's sensitization. I believe you've heard that different people have different blood groups. We have people with blood group A, blood group B, AB, and O. And I also believe you've heard that some have A positive, A negative, B positive, B negative. Now, when somebody has a positive blood group, that means their blood has something that we call the Reisha's antigen. And if they have a negative blood group, that means that they have no Reisha's. And you might think that anybody with a blood group A can donate to anybody with blood group A, but that is not the case, because if somebody has A positive blood and another person has A negative blood, this means that this person cannot donate to this person because this person has a Reisha's antigen. This one does not have a Reisha's antigen. So when this person donates blood to this person, the Reisha's antigen is detected as a foreign material in this person's blood, and so they start fighting against it. They produce antibodies to fight against that antigen, and so this person cannot donate to this person. And now you will ask me, we were talking about abortions, but now I am talking about blood groups. Now here we have a mom, a father, and a baby. And so if either of the parents has a positive blood group, that means that the baby's blood group will be positive. So if the mother is positive, the father is negative, the baby will have a positive blood group. If the mother is negative, the father is positive, that means that the baby will have a positive blood group. If both of them are positive, the baby will still be positive. But if both of them are negative, that means the baby will be negative. Now, the case of interest to us right now is the second case, where the mother is negative and the father is positive, meaning the baby will be positive. So in this case, if this woman has a miscarriage or if they have an abortion, the fetal blood may mix with the maternal blood. And what this means is the fetal blood has the rhesus antigen, but the maternal blood does not have rhesus antigen. And so when the rhesus antigen is introduced into the mother's blood, that means that the mother's blood will develop antibodies against this rhesus. And that is okay in this case. But in future pregnancies, now, if it is the same father who has a positive blood group, that means that the baby will still be positive. But remember, in this case, the mother has antibodies against the rhesus antigen. So the mother's blood will be fighting against the fetus, and this can lead to something we call hemolytic disease of the newborn, or it could also lead to subsequent miscarriages. And it is advised that after an abortion, a woman gets what we call anti-D to prevent rhesus sensitization. But the WHO, that is the World Health Organization, says that when a woman is in the first trimester, that means in the first, second, and the third month of a pregnancy, and she has an abortion and she has a miscarriage, there is no need for rhesus sensitization. But if she is in the second trimester, that is month 4, month 5, month 6, going upwards, there is need for this woman to be given anti-D injection now to prevent rhesus sensitization. And this could explain why some women who had abortions have subsequent miscarriages. But I always like to say that if you are having trouble conceiving, the best thing is to seek medical advice, because fertility issues could evolve from many things. They could result from gynecological issues such as PCOS, endometriosis, fibroids. They could also result from lifestyle factors such as maybe the woman is drinking, maybe she's smoking, maybe the foods that she is eating. So the best thing is not to make assumptions that I am not getting pregnant because maybe I had a miscarriage, because maybe I had an abortion. No, the best thing is to seek medical advice. Go to your fertility doctor, go to your obs-gyn, and they will do some tests, they will ask you some questions, they will do a proper history check and know the best way forward. And with that, I really hope that we have understood abortions, the different types of abortions, and how abortions can impact fertility. If you like this video, please do not forget to give it a thumbs up. And if you have not subscribed, my dear, please subscribe and hit the notification bell down below.